Hello, everybody. My name is Connie Jorsvik. For people who don't know me, I am a healthcare navigator and patient advocate. I am an educator about serious and complex illness, as well as end of life. And twice a year, so in March and April, and October and November, I do a series of live uh, webinar workshops. And I also speak in the community. So if you have anybody, if you've got groups that are able to pay a small honorarium, I would love to come and speak to you. If this email was passed along to you and you are not a part of the newsletter group community, at the bottom of every email, there's a place where you can subscribe. And so I encourage you to do that because the recordings go out the morning after the workshop. I haven't put last night's on about heroics and end of life, and I'll be putting that on tomorrow morning along with this one. With that said, here is my dear friend, Alex Muir, who is the chair of the Metro Vancouver chapter of Dying with Dignity Canada. Over to you, Alex.
Okay, thank you, Connie, and thank you all for coming. For those who have heard this before, I hope I don't dwell too much. And so, Connie, if I'm spending too much time on a topic, just tell me to move it along.
Okay, I promise.
And Connie, we have changed the order of some of the slides. We're focusing on a few different areas tonight, so we'll see how it goes. Now, why isn't it going forward?
You clicked on the slide. There you go.
There we go. Okay, so to start with, what is medical assistance in dying? So MAiD is a planned death with the assistance of trained healthcare providers, which would be physicians or nurse practitioners, and they are most often members of and have received training through the Canadian Association of MAiD Assessors and Providers, and you'll hear about that group quite a bit, I think. In Canada, MAiD can be either clinician-assisted or self-administered by oral medication, although the medical practitioner must be in the room, either way. Now, the use of oral medication is quite rare in Canada. Almost all MAiD provisions are done by injection, and that's because it is quicker and more efficient than the oral route. Some people actually apparently the oral fluid is quite bitter, and some people throw up and or their body may reject it. So that's why the injection is preferred, and it's also much quicker. But by injection, it takes minutes basically for someone to die, whereas oral can take up to maybe half an hour. Is what I've heard. In Canada, MAiD is under federal jurisdiction, but it's administered by each province or territory, and that's why because it's under healthcare. So it's a bit awkward because you've got federal legislation, but then each province has its own process and own forms that need to be filled out. Just a comment about the Canadian system. It does differ quite a bit from what happens in the States, because the States and there are 10 states plus the District of Columbia that have assisted dying, because it's through state legislation down there, and they basically follow the oral route. And so basically, someone once they get approved, they go to the pharmacy and get the prescription and take it home, which you can imagine could lead to some problems, and it has. There have been some pretty horrible cases, not a lot, but occasionally. I'm surprised they've allowed it to actually continue that way, because there's no requirement to have a medical practitioner in the room at the time. The other big difference between Canada and the US is that it is covered under a medical system, so there's no cost to the individual, whereas in the US, individuals, unless they're under Medicaid, have to pay for the drugs themselves. So I just want to quickly talk about the evolution of MAiD in Canada, and I won't spend a lot of time on this. I know I have in the past, but just so people are aware of how it evolved and the strong role that women from BC played in the the advancement of MAiD in Canada. I think many of you will likely remember Sue Rodriguez in Victoria. She was a 42-year-old woman with ALS, and she applied to the courts with the help of the BC Civil Liberties Association for a doctor to help end her life, which at the time was illegal. This is back in 1993. And she asked the courts, if I cannot give consent to my own death, whose body is this? Who owns my life? And this case went all the way to the Supreme Court of Canada, and unfortunately, she lost in a 5-4 decision. And by the way, she ended up finding a sympathetic doctor the following year to help end her life. But the significance of that case was profound, because what it did is it brought the issue of assisted dying out of the closet. People were talking about it. It had huge media coverage around the world. And so people started talking about it. Surveys started happening, and the Canadian citizens were polled as to, is this something that you would like? And at that time, support was in the 60 to 65% range. It's now around 85%, but it really started the discussion. And what happened over the next 20 years is that support for assisted dying was increasing. As successive surveys were conducted, there was more and more support for it. And also the Charter of Rights and Freedoms came into effect, and the courts started expanding the reach of it to address liberty and security of the person, which included end-of-life choices. And so that was the backdrop in 2010, 2011, when Gloria Taylor from BC, and what did she have? She had ALS, same as Sue Rodriguez, and Kate Carter had post-polio syndrome. With the BC Civil Liberties Association, again, they went back to the courts with using the same arguments, but this time, because of the chain with the charter arguments and also the strong public support, the courts actually agreed in a 9-0 decision at the Supreme Court that they said, yes, the existing law is unconstitutional and it needs to be changed. And so that is what led to what's referred to as the Carter criteria, which kind of established the rules around medical assistance in dying, and that became the basis for Bill C-14 in June of 2016. Oh, sorry. So that was in June of 2016. It became legal. So who is eligible for MAiD in Canada? And I'll just quickly go through these points. You have to be eligible for publicly funded health services in Canada. So if you have a PHN number in BC, you're good. And the reason they did that is they wanted to avoid death tourism. They don't want people coming to Canada from other countries trying to access this. You have to be at least 18 years of age and capable of making decisions with respect to your health. And the big criteria, your condition must be grievous and irremediable. And what does that mean? So irremediable was determined by 2 independent medical assessments, and it means that you must have a serious illness, disease, or disability, and be in an advanced state of decline that cannot be reversed. The grievous is related to your suffering. So you have to be experiencing unbearable physical or mental suffering from an illness, disease, disability, or state of decline that cannot be relieved under conditions that the person considers acceptable. And this is something that is determined by the individual, not the assessor, because as you know, we all suffer differently. We have different tolerances of pain, and there could be mental suffering in addition to the physical suffering. So each individual would know when their life is becoming intolerable.
I just want to, before you move forward on the next slide, point, Alex, I want everybody to be very cognizant of number 3 and number 4 as we move forward, because there will be questions, especially regarding what's going on in the news right now.
Yeah, so the next point is it is a voluntary request with no external pressure, and that is something that is tested throughout the MAiD process, right from when you make the request to when you get assessed. And the very last question that you get asked actually is, do you still want to continue? So there are lots of checks along the way to make sure that there's no external pressure coming to bear. And there must be informed consent and counseling. So the assessors have to inform the individual of the means that are available to relieve their suffering, so including palliative care. So there may have been treatments that they hadn't considered, and these options have to be pursued. So that's kind of the snapshot, and these were all part of the Carter criteria that were established. So I thought rather than I thought I would just give a snapshot of where we are with the legislation, because it's really confusing trying to follow this stuff in the media and in the news about what's happening. So just in a snapshot, as I mentioned, in June 2016, Bill C-14 started the access to MAiD, but at the time it was limited to reasonably foreseeable deaths. And immediately that was challenged by people who did not have a reason for foreseeable death, because they said that basically you're violating our right to equality. And so the big case that got a lot of coverage and led to the changes was in Quebec, and that was with Jean Trouchon, who had cerebral palsy, and Nicole Gladieux, who had post-polio syndrome, same thing that Kay Carter had. And they said that that the restriction infringed their charter rights to liberty and security of the person, and it was unconstitutional because they weren't treated equally under the law. The judge in Quebec agreed with them in September of 2019 and said this law has to be changed. And the federal government looked at it and they actually agreed. They didn't challenge the court ruling, and that led to Bill C-7 in March of 2021, which was expanded to include not reasonably foreseeable deaths, but there was a specific exclusion for those with mental disorders as the sole underlying medical condition. And there was a 2-year waiting period while they worked out processes. As that date approached, there was a whole bunch of discussion and debate, and the government said, no, we're not ready. So they pushed it out another year. So in February, Bill C-39 extended what we refer to as the sunset clause to March of 2024. And then as that deadline was approaching, again, everything was reviewed, and it was extended another 3 years now to March of 2027. So what that means is people with a mental disorder as a sole underlying medical condition cannot access MAiD until at least March of 2027, which we think is not right, but we can talk about that later. But
And
we're
going to be discussing why dementia is not included in that, correct?
That's right. Anyway, so that kind of gives you the overview of the legislative changes that have happened with medical assistance in dying. So let's go back now and talk about what happened with Bill C-7 in March of 2021. So we now have 2 tracks. So if your natural death is reasonably foreseeable, but you're considered track 1. If your natural death is not reasonably foreseeable, that's track 2. And if we compare the two, you'll see that the eligibility criteria that I talked about on that slide with the 6 points, it's the same for either track. So basically, grievous and irremediable is the same for both. You have to have a signed application, which has to be witnessed by someone. It used to be 2, now it's only 1. That was one of the changes they made under Bill C-7. You have to have 2 assessors, independent assessors. And the difference between track 1 and track 2 is that for track 2, one of the assessors has to have expertise in the condition that you're qualifying under, to make sure that they get expert advice. The waiting period, there's no waiting period for track 1. So if you've been assessed and approved, then you can pick a date, any date you want. However, there's a 90-day assessment period for track 2. And that is to allow time to make sure that the applicant has considered all the options that are available to them. And so they have to, the assessors have to actually investigate options in terms, including counseling and mental health supports, disability supports, community services, and palliative care. And they have to be, the individual has to be offered consultations with professionals who provide these services. So that's why there is a 90-day period. So despite what you may hear in the media about some stories about people being able to access things quickly, it really is quite a rigorous process. The other change that happened with Bill C7 is something called a waiver of final consent that's available for people on track 1. That came about from something called Audrey's Amendment. Audrey Parker was a woman in Halifax who, back before they had waiver of final consent, had been assessed and approved for MAiD, but the requirement is that you have to be mentally competent at that time. You had to be mentally competent right up to the day of provision or the time of provision. And what happens in her case, she had breast cancer, which had metastasized, gone to her brain, and she knew that she was going to lose mental capacity. So she says, I cannot take the risk, even though she wanted to live to Christmas to spend it with her grandkids. She said, I cannot take this risk. I'm going to die on November the 1st. And what she had done is she documented her whole journey and her arguments on YouTube. She was very articulate and said, this law has to be changed. And so that actually was a change that was made as part of Bill C7. And so what happens now is someone on track 1, so someone whose death is reasonably foreseeable, who has been assessed and approved for MAiD, is now able to sign this document with the MAiD provider saying, if I lose capacity, and you have to pick a future date, if I lose capacity by that time, please proceed with the provision. So, for example, if I'm assessed and approved today, I can say to the MAiD provider, okay, if I lose capacity by June 30th, please proceed. And so if sometime between now and then, if the doctor and the family agree that I have lost capacity, then you can go ahead with the provision. If June 30th comes along and I'm still feeling fine, then I can just tear that piece of paper up and I can sign a new one with the doctor and push it out to December 31st, for example. So this has been really good for people, for people on track 1 who have been approved, but they're not forced now to end their lives earlier than they would have wanted. The other, I guess the last thing about comparing track 1 and track 2 is the confirmation of wishes. You do have to confirm your wishes right up to the day of provision unless you sign this waiver of final consent. That's for track 1. And as I mentioned, for track 2, there's a whole process you have to go through in terms of counseling and all that other stuff. And remember too, there is the exclusion, as I talked about before, for someone who has a mental illness or disorder as the sole underlying medical condition. So that's kind of a snapshot of the difference between track 1 and track 2. I just want to quickly show this slide because I think it's important. MAiD deaths have gone up by about 30% each year since it started in 2016. And if you read some of the reports, especially from other countries, I've read several in the British media that go, "Oh my God, Canada's killing off their elderly. Look at their numbers," and what's really happening here is people are finding out that this is a valid end-of-life option. And back in 2016, this is something that was not talked about very much. You wouldn't find anyone, if they had a member of their family who'd gone through MAiD, no one talked about it. Now it's much more in the open. You read about it in obituaries, people talk about it, and I meet more and more people who have a family member or know a family that has been through a MAiD death. And I think this is a good thing because it's basically taking the stigma away from medical assistance in dying. And people are actually considering it as a valid end-of-life option. The other thing on this graph I wanted to point out is track 1 and track 2. So the blue is track 1. So people whose death is naturally foreseeable. So remember that changed in March of 2021. So now people on track who can access it. But look at how low the numbers are. It was 2.2% of deaths in 2021, and then 3.5% of deaths in 2022. So very small percentage. And if you go back to when the arguments were happening about whether or not to allow track 2, those who were opposed kept saying, "Oh my God, you're going to open the floodgates. We're going to have people dying left, right, and center if you allow them access to MAiD." But as I was pointing out, there are a lot of steps to go through and a lot of safeguards, and that's why this number is so low. And we think it's going to stay relatively low because the hurdle is quite high. Okay, so Connie, let's talk about this. Okay, so what is a mental disorder as a sole underlying medical condition? So this exclusion that's in place right now includes conditions that are primarily within the domain of psychiatry. So things like depression and personality disorders. It does not include neurocognitive and neurodevelopmental disorders. So conditions like dementia, which would include Alzheimer's, Huntington's, Parkinson's, are not mental illnesses. And so what that means is people today are able, with dementia or Alzheimer's, are able to access MAiD as track 1. But it is tricky. It's not straightforward, but they do not fall under this exclusion. So can a person with dementia access MAiD? Well, sometimes, but it is tricky because you must not lose capacity before satisfying the eligibility criteria. So the way it works is like the doctor will look at the individual and they'll do an assessment, and they have to agree that this person is, if you go back to the criteria, grievous and irremediable. So they have to determine that the person is in a downward track and they're not coming back, right? And that's something that is in the early stages of Alzheimer's is hard to assess and agree to. So the doctors, the assessors, need to find the point where the person is clearly on a downward trajectory, and then they will say, yes, we can proceed, and that's fine, but as long as the person still is able to make medical decisions. The tricky part is if the person is applying and they wait too long and they're so far gone that they can't make medical decisions, then they've lost their ability to consent and proceed with it. So it is actually quite tricky. I mean, people have done it, but it's catching it at the right time. And so that's why we tell people that if you're in the early stages of Alzheimer's, it's good to get assessed early because it at least establishes a benchmark with the assessors. They may not agree that they may not approve of that you meet the criteria the first time around, but at least they've got a benchmark so that the next time you go back 6 months later or whatever, they can actually see that there is a downward trajectory.
I'm going to bring up a couple of things here. It is not,
Sorry.
yeah, that's okay. It's not the criteria for capability regarding medical capability are much different than capability from a legal and financial point of view. So the doctors and nurse practitioners who do these assessments, and it's my understanding that when somebody has dementia, they will call in the people who've done this a lot, not just your primary care practitioner, but an expert on this who do these with people with dementia on a regular basis. So they're not looking whether you can still balance your checkbook or whether you can get your own groceries. It's more of an understanding that you understand your disease process, that you understand that you are not enjoying the way that you live, and that you understand that you will die when this is put in place. So I've had a couple of cases where people were probably had moderate dementia and they were able to access MAiD. But every case of dementia is different. So some people, it's all about executive functioning. And that's only something that can be done by an expert, whether this person's got the executive functioning to be able to manage. It's not memory, it's about um, do you understand the consequences of your actions? The other piece is that if you have a diagnosis of dementia, I've noticed a couple of things. Number one is that doctors are really reluctant to tell their patients when they've got a lower cognitive score, um, and they're trying to protect the patient. So it's important that as an informed and empowered patient or care partner that you're asking for that information. If a cognitive test, most often called a MOCA, M-O-C-A, is done, that you are asking for the results and find out what those mean. And there's lots of information online, what a score of 20 out of 30 means. And somebody's going, it's getting worse and it will get worse over a period of time. And to get that, as Alex said, get the process started early, even if they're saying no, not yet. And I'm going through this with a client right now. They said no, not yet. And we've been reapplying every 6 months. And finally, yesterday, we got the diagnosis that we were looking for, that she would now be eligible. So they keep your file, open. And when that stuff comes up, the other massive thing is tell your family what you want to do, because I've had so many people who've come to me and we've talked about this kind of thing and we've put things together and they don't talk to their family. I got a phone call about 3 months ago from a daughter who said, Connie, I found your paperwork on the kitchen table. Who are you? And so I had told her that her mom had talked about MAiD with me and getting that put together, and her mom had never talked to her. So it's really important that you're talking to your loved ones, because when you have dementia, the last information is the first information out of your memory. And so you're likely not to remember that you have begun this process. So tell your people. That's all for me.
The other thing too, Connie, tied to that as well, is that if you have been assessed and improved and you have dementia, um, that you are able to sign a waiver of final consent with your provider, so that if you're obviously going to lose capacity down the road, you've got this in place so that they can actually proceed with it. There have been cases, many cases actually, where people don't sign a waiver of final consent, so they're assessed and approved, but they say, well, I'm not ready yet. But then they just wait, and then they lose mental capacity and they can't consent. So it's one of these things you have to either act on it or sign a waiver of final consent.
I've got a client right now who has she's got brain disease and a neurocognitive disease, and she and her provider redo the waiver of final consent every 6 months, just to make sure that it's, and they come up with a date. And you're going to be talking about the waiver more in depth, right?
I wasn't actually, but we can
Okay.
if you want.
Yeah, let's talk about it briefly.
Okay.
So what does that mean? And from my understanding, so please tell me if I'm wrong, is that you are given a provision and you might lose capability in the future. So the most common things are dementia, a neurocognitive disease such as ALS, especially cancer of the brain. Oh, please, please, please put this in place if you've got brain cancer, and do it early. And if you've got a cancer that might incapacitate you due to pain and you're needing palliative sedation, and you get to choose the date where that's going to take place. And some people say, well, my kids are coming to visit from, out of province, and they'll be here on May the 1st. So we're going to set it for May the 1st. And if you get to April the 30th, as late as April the 30th, and you're not ready yet, and you're still enjoying your life and things are going well, and you want to wait until your family leaves, or whatever the reason is, you get to make a new waiver of final consent for a future date. But in my experience, a lot of people don't wait for that date. The waiver of final consent is too far away, and
Right.
so they enact it early.
Right. And that usually is driven by that would be the doctor and the family. Like if the person has lost capacity, it's really the doctor having the conversation with the family saying, yes, they're at that point. But coming back to your point before, Connie, is that's why it's important that your family is aware of what's going on here. And because they will be involved at that point.
Mhm.
Right. So so what is just looking more generally, what's the process in BC and what are the safeguards? So step one is the patient must make a written request, and it's called Form 1632. It's on the ministry website. Oh, and by the way, Connie, will you be sending out that resource page after?
Yeah, yeah.
Yeah, so I don't know if I sent it to you recently. I can send it to you again if you want. It's a document that's got links to all these things we're talking about, and it's much better as an electronic document because it's got these links that go to websites. And then you don't have to type up these long URLs. So I'll let me know if you don't have the most recent one. It's from March, and I can send it to you, Connie, and then you can send
Is
it
it
out to
is it on
everybody.
the web? Is it on the website?
No, no,
Okay,
it's one that
okay, I'll
I
get it. I'll get
it's
it from you.
okay. Okay. So if you look at Form 1632, the important part of it's a three-page document, and two of them are filled out by the applicant and one's by the witness. But the important part is this: these are the statements that the applicant is initialing. So I request medical assistance in dying. I make this request voluntarily, without pressure from others, and if I'm found eligible, I expect to die when the prescribed medication is administered. I've been informed by a practitioner that I have an incurable illness, disease, or disability. I believe that my medical condition is serious and cannot be relieved by any means I accept. So those two statements are talking about the irremediability and the grievousness. And then where required by law, I understand that my information will be shared with other health professionals directly involved in my care. And then I can and have the right to change my mind and to ask questions at any time. So filling out the form does not obligate anyone, right? You can change your mind at any time. And the last one is it's really a CYA for the government. It says I understand that it's my responsibility to seek advice on my life insurance policy, but Canadian insurers are not allowed to disqualify someone for um, accessing MAiD. We only know of one case where someone was refused, and it's because they had a British life insurance policy, because MAiD is not legal in Britain. So, but in Canada, they cannot disqualify you. So the form has to be witnessed by someone who will not benefit financially or materially from your death. So that generally excludes family members. So most people will ask, a friend, a family friend. And the other thing that happened with Bill C7 was that healthcare workers are now allowed to act as witnesses, paid healthcare workers. So social workers, nurses can act as witnesses, and that's been really good. Like both Vancouver Coastal and Fraser Health now use their own staff in their facilities to act as witnesses. If people, sorry.
And we can do it remotely as well. So Alex does witnessing remotely. Um, I do witnessing remotely. That is, by the way, a volunteer thing for me. And so what you do is you're both on a computer with a computer screen. You get the person's ID and talk to them, and then you point it down towards the page. You're watching them sign it, initial it, and then you can exchange the paperwork so that it's complete.
Yeah, and Dying with Dignity does this as well. So we have a bunch of volunteers that do this. So what happens is if the health authority informs us if someone doesn't have a witness, and then they come to us, and we provide witnesses either in person or virtually. depending on what the individual wants. So that's another option that people have. Okay, so I want to go back to the other steps. Okay, so as I mentioned with the process, so once the paperwork is signed, then two physicians or nurse practitioners must confirm eligibility, and they have to be done independently. And then, as I mentioned, there's no waiting period for track 1, 90 days for track 2, and the individual has the opportunity to withdraw the request at any time. So practical considerations for MAiD. So one of the most commonly asked questions is, what if someone in my family objects to me having a MAiD, an assisted death? And I mean, the quick answer is it's your right to choose MAiD. It really it's a personal decision. You don't need consent from other people. But having said that, it's really helpful if your family is on side. And there are tools out there to help get the conversation going. And virtual hospice is one of them. They've got some good videos and suggestions on how to get the conversation going. And one of the suggestions that Connie has talked about is basically writing down why this is so important to you, and reading that or giving a copy to a family member, saying, let them go away and read it, and have them come back and discuss why this is so important to you. So what we've seen the full range of people who are fully supported by families, and those who are completely estranged, or they hide the fact they're going to go through a MAiD death because they know that there's no support within their family. And boy, it's so much easier when you've got your family supporting the decision. It just makes it easier on everybody. There are some other practical considerations, like where do you want the procedure to happen? I'm sure you've read some of the stories about people doing it in the forest or on the beach, but the big decision for people usually is, do I want to do it at home? And some people want to do it at home because of the comfort of home. Other people definitely don't want to do it at home because they don't want the family members left with that memory in the house. And so they would prefer to go to a hospital to have it done. So these are just considerations that you have to think about. You also have to arrange with a funeral home, or if that's the route you're going, but arrange, think about the disposition of the body in advance. And then there's the day of the event, thinking about what you want to do. Some people have had, parties, either a day before or 2 days before, or the day of. And also, do you want any ceremony around the actual event in terms of, readings, music, champagne is fine too. So these are just some practical considerations to think of. Anything else you want to add, Connie?
No, I'm good.
Okay. Oh, this thing is fickle.
You have
Okay,
to go
so
back. Yeah, go back and click on your slide and then move forward.
yeah. So what's next with the legislation? So I'm just going to quickly recap what happened. Back when Bill C-7 passed, in the bill, they said, okay, there are 5 areas that require more investigation and more work, and this triggered a bunch of work in Parliament. So they said you need to address these issues. Mature minors, should they have access to MAiD? Mental illness, at which we know that there's been tons of work around the mental illness issue, and as we know now, it's been pushed out to March of 2027. But also advanced requests, the state of palliative care in Canada, and protection of Canadians with disabilities. And so there was a special joint committee that was struck, heard from 150 witnesses, received a bunch of briefs, and then the committee came out with with 23 recommendations in these 5 areas. And the one that I really want to focus on is advanced requests. this is the number one issue that Canadians have. This is what we hear about this issue more than any other. So what people want is they want to be able to say when they're healthy that in the future, if I reach these future conditions, that I want to be able to access MAiD. So 82% of Canadians support it for after you've received a diagnosis. 72% of Canadians want it. They want to be able to do this even prior to any diagnosis. And that was from our latest polling in June of 2023. Apparently, there was another poll just completed a few weeks ago, and the numbers are they're very similar. I think it's 1% higher. So this is something that we are advocating for quite strongly. There was a federal e-petition which gathered 16,000 signatures. It went to Parliament on February 13th, and the government has 45 days to respond to it. And so we'll see what they come back with. There's also a BC provincial petition underway, and apparently it's going to be it's got about, last I heard, it had about 1,100 signatures. It's going to be presented to the legislature on April 23rd by Susie Chant, who's the MLA for North Vancouver, and we will be sending we'll be sending out notes to people to get them to write to their MLAs to support this this initiative. So just to answer the question, can I arrange an advance request for MAiD? And the answer is today, no. That's right. And that's why we're pushing quite hard, because this is what people really want. It's, in a way, it's almost too bad that there was so much focus around the mental illness issue, because the mental illness legislation was really aimed at people who've been suffering for long periods of time. And so it was really addressing a very small number of people. But because it was tied up in Bill C7 and it had to be addressed, that's where all the discussion focused on. And it's too bad, because I mean, where the conversation should have been was on advance requests, because that's really the more popular topic and the one that people really want to see change. So we'll have to see what happens now. And unfortunately, if we're looking at what's happening with politics in this country and where it's going, we know that there aren't going to be many changes if the Conservatives get in, right? So the timeline to make these changes is very tight. It basically has to be done within the next year and a half, or it's likely not going to happen.
Before you move on, Alex, I would invite everybody to start putting your questions into the chat. And please bring up the more controversial things that you've heard about MAiD, so that we can discuss some of that during our questions and answers. Okay, all yours.
Okay. Okay, one of the other areas was mature. I wasn't going to talk about mental illness because we talked about it already. There was advance requests, mature minors. So the committee supports access to MAiD for minors whose death is reasonably foreseeable, so track 1 only, and deemed to have requisite decision-making capacity upon assessment. Now, they also said, though, they propose research and consultation over the next 5 years. So we know that nothing is going to happen. This again is a very controversial area. So we won't be seeing any change in this. So there will be no access for mature minors in the foreseeable future. Oops. People with disabilities. So the committee supports persons with disabilities by implementing measures to reduce poverty and ensure economic security. And they said what they were recommending was establishing an expert panel to study and report on the needs of persons with disabilities. And I mean, on the positive side, they have passed what's called the Canada Disability Benefit Act. It's Bill C-22, and so it's been passed. And so there's recognition that there are more supports needed for people with disabilities, but they haven't actually done anything with the dollars. They haven't actually attached money to it. So while it passed like about a year and a half ago, nothing has happened. And so it's really tragic that people are sitting there waiting, people need the money. And nothing has been forthcoming. But what I did want to address was this question is, can a lack of social supports, housing, disability supports, home care, qualify a person to receive MAiD? And the answer is no. There's no question that someone who is without housing or is suffering from a disability and can't get the home care they need will have increased suffering, and that will they will they may want to access MAiD more than someone who has those supports. The reality, though, is that to be eligible for an assisted death, you have to have a serious illness, disease, or disability, be in an advanced state of decline that cannot be reversed, and experience unbearable physical or mental suffering. So it's not as it's depicted in the media sometimes, that someone says, oh, I'm going to be homeless, I'm going to access MAiD. They still have to meet the medical criteria before they can access MAiD. And it is tragic that we've got people who are thinking that MAiD is their best option because they don't have the financial and basically or healthcare supports that they need. And palliative care, they recommended increasing funding for the implementation. There was a big plan that was put together with all sorts of recommendations, and we're hoping the government said they're going to put some money behind this. We hope it happens, because there is a real shortage. I mean, there's a huge need for palliative care in Canada, but there's not nearly enough money that's gone into it. So we're hoping that the one good thing, this is going to sound a bit counterintuitive. The one good thing I think about MAiD legislation is it has really forced these conversations. I mean, it's highlighted, it's the shortfalls that we have around palliative care, around disability supports, because people are saying, I want MAiD because I can't access these other things. So I mean, let's just hope that funding is provided in some of these other areas, so that people don't feel that MAiD is their best option.
Before you go into that, if we could step back for a second and just have a bit of a discussion around those things, in that both Alex and I have been involved since the very early days of the MAiD legislation. And when we first started, there was I had a huge concern that people were trying to access MAiD because they were living in really terrible conditions, or they weren't being seen by specialists fast enough. It's one of the things that I'm hoping that the mental health legislation will change as well. So what's happened is that chronic pain is just a huge issue. It takes anywhere from a year to a year and a half to see a pain specialist. And so this really puts the pressure on the health system to provide supports for the patient in a timely manner. And it's made a really big difference. One of the people who talked at the on Saturday was talking about that, in that when you are treating somebody's underlying depression, and depression can come from chronic pain or other underlying health issues, and when you treat the depression, then they no longer want MAiD or need it now. When you are treating somebody's pain adequately, it becomes a palliative care issue, and they're not needing the pain, or they're not wanting to access MAiD because they're in so much pain. So there's actually been a lot of good that's come out of forcing this issue of, that somebody's got to see this person within 3 months. And that's the healthcare teams. That's the onus is on the healthcare team to do that, and not the patient, which makes a big difference. And regarding this slide, Alex, I was wondering if you could just, I know that there was talk on Saturday about it, palliative care and MAiD coming together, and that one of the speakers was both a palliative care doctor and a MAiD provider,
Mm.
and how they're starting to come together.
Yes, it's been a fairly contentious issue because initially when MAiD first came out, it really was not supported very much at all by the palliative care industry, and even now there is still some division, within that industry, but it's much better than it has been. And as you mentioned, Connie, there are palliative care doctors who are now also MAiD providers, which is a good thing to see. But but having said that, there are still some palliative care doctors who feel quite strongly that MAiD should not be part of palliative care. So there still is division out there, but it is getting better. There's no question. Yeah.
Thank you.
Oh, does it do that? Okay, so in BC, so I want to talk briefly about this. It's in British Columbia, the Ministry of Health in 1995 signed an agreement with the Denominational Health Association, which is the umbrella organization for faith-based healthcare facilities in BC. The largest member by far is Providence Health. And what this master agreement said is that basically you don't have to do anything, provide any services which conflict with your beliefs, right? And Providence Health being being, has a Catholic board, said, okay, we will, so we will not provide MAiD, we will not provide abortions, we will not provide contraceptives, and so and that's and that's why. Then what this does is it leads to what we call forced transfers. So this is when someone who's in St. Paul's, for example, and says, I want to access MAiD, they will allow them to fill out the form, they will allow the assessors to come in and assess them, but when it comes to actually providing the service, they ship them off somewhere else. And it's it's cruel, basically, because these are people who are already in severe pain near end of life, and they have to be put on a gurney and sent off somewhere else. They have to be sedated appropriately. And what happens sometimes is they're not sedated enough because the person wants to retain their mental capacity, and so they're under sedated, and so they suffer on the journey. And it's also something that's totally unnecessary when you think about it. MAiD is actually a fairly simple process. There's no specialized equipment required. There's no, I mean, any doctor or nurse practitioner who can administer a needle can provide the service. So there really is no reason, there's no logistical reason that it couldn't be provided in someone's bed. So this is something that, given that Providence Health receives huge funding from taxpayers, we think that the full range of services should be offered at St. Paul's, for example. And what's happened, there was a case you may have heard about last summer with Sam O'Neill, 34-year-old woman who was trying to access MAiD from St. Paul's. So they were going to ship her over to VGH, and there was a mix up. It got delayed, and they had to, and then they had to heavily sedate her by that point. So she finally arrives at VGH where her parents are waiting, but she basically lost because she was so heavily sedated, she went under. She had signed a waiver of final consent, which allowed the doctor to proceed, but she never got to say goodbye to her parents who were waiting at VGH. So this got a lot of coverage in the press, and so the Minister of Health said, "Oh, because people were saying this is ridiculous," and the new St. Paul's, which is being built, with $1.3 billion with taxpayer money. had no, they had said, we're not gonna provide MAiD there either. And now they've said, okay, we have a solution. What we're gonna do is we're gonna have a tunnel, and because we won't allow it to happen on site at St. Paul's. So now they're gonna wheel the person through this tunnel across the road to a facility that's not part of St. Paul's, and that's where they're gonna provide MAiD. But the person still has to get, put on a gurney and shipped across the road. So it's better than being transferred in an ambulance, but we don't see why the person should be transferred at all. Anyway, so it's something that we're continuing to fight for.
And I just want to point out that people go, well, what's so bad about an ambulance? I've been in the back of an ambulance with several of my clients, and they've been in a lot of pain going to the hospital. It wasn't for MAiD, but they were heading to the hospital. And I don't know what they do with the shocks on those ambulances, but they don't exist. And those stretchers are uncomfortable, especially if you're a bigger person. They don't fit a bigger person well. So it is just, it truly is agonizing for people who are in a lot of pain.
In terms of other access issues, doctors who are conscientious objectors are supposed to provide an effective referral to patients seeking MAiD, if asked. The wording in the wording in the guidelines for the College of Physicians and Surgeons of BC is not very good, and we've actually written to them trying to get them to change it, and they haven't seen the need to. What I tell people is if they get any resistance from their doctor, or if their doctor's not, if they know that he or she's not cooperative, just go to the health authority. The assisted dying teams in the health authorities are great. And that's where people can go to find assessors. They'll help people through the whole process, explain it to them. They're well staffed and well run. So we actually are quite fortunate in the Lower Mainland with what we have compared to other stories I've heard across Canada. So. And by the way, the article the resource document that you'll be receiving will have links to all these, like to the health authorities and other resources you can access. The other
Not only that, I mean, I think that the chapter that we co-wrote in my book and on my website, which can be accessed for free under options for or at end of life under Learn. That is up to date with all this information as well. And so all you have to do is click on the links there, and it's all right there.
Okay, that's good. Thanks. Rural access, we're kind of lucky being in urban areas where we've got enough MAiD assessors and providers. It's more challenging in rural areas. The one good thing though is when COVID hit, one of the good things out of COVID, that's when virtual witnessing started. That's when virtual assessment started. So people in rural areas can now have medical assessments done virtually by computer, which has been really helpful for people who couldn't access doctors before. And that is about it, actually. Those are just some phone numbers and stuff.
So maybe leave that up for a few minutes and
Okay,
I'll
sure.
go to some of the questions.
Okay.
So one of the questions was chronic pain of arthritis, would I qualify? The answer is a definite maybe. If you are having any trouble with your doctors being on side with this discussion, then reach out to the MAiD coordinators for every health authority, and they can help you with that. But just like everything else, start early, and because the answer might not be yes now, it might be yes in the future. So don't hesitate to do that. Could MAiD be reversed or eliminated if the Conservatives get in? I will let you have that one, Alex.
Okay. I think they will not get rid of it entirely because I mean, they're not that stupid because MAiD is supported by 85% of Canadians for track 1 I'm talking about, right? So but what I think they may do though, they've already said they're going to we have this, the mental illness extension to May 2027. They're just going to eliminate. They're hoping to just eliminate it totally as a possibility. I also believe they may try and go after track 2, which is not reasonably foreseeable. They have, some of their MPs have been arguing that back in 2019, the Liberal government should have challenged the Quebec court ruling, and that may have had a different result that went to the Supreme Court. I don't think it would have. But what they could do is, if they get enough votes in Parliament, if they have a majority, and they vote it down and they attack track 2, it will force another court case and it'll go back to court. So I think because it's based on Charter of Rights, it's going to stand the test of time. But there could be bumps along the way. They could try to block it, and then it'll have to get reinstated. But I think the Charter of Rights has driven so much of this stuff that they would have a difficult time getting rid of it permanently. Track 2, I'm talking about. And track 1, they'd be crazy to challenge it. I don't think they will.
But there is a huge lobbying sector, mainly from some religious organizations.
Yep.
Who've put a lot of money and a lot of time into this. And so my recommendation is, if this is something that's really important to you, that you keep up regularly and maybe get on the Dying with Dignity newsletters, so that when there's a petition that comes out, that you are amongst the first to sign it. The grassroots level is so important for this. Become a member if you can afford to, with a small donation every month. So if this is important to you, then maybe this is a place that you want to become a bit of an activist for.
Yeah, you don't even have to become a member, actually, Connie. You can just become a supporter and get on our email list. That's the most important thing, is if you can just get on our email, sign up as a supporter and get on the email list. And because what we do, as you say, is that that if there are any moves to move back the legislation, we will be writing petitions. And so we rely on the support of Canadians to sign these petitions. And that's how we got 16,000 signatures for the advance request one. Yeah.
I'm waving goodbye to a couple of people who are leaving, so thank you so much. And please pass along the recordings to anybody that this might be important to when you get them to tomorrow.